Okay, we'll look at the anatomy of the ear. Here is what is classically known as the ear. You just touch this skin part. But what that is, that's the pinna. Okay, P-I-N-N-A, the pinna. There's a lateral view there. Here's an anterior view of the pinna. Okay, so sound waves would come in this way. Okay, from the outside as they work their way medial all the way to the inside into the brain. Okay, so we have the pinna, and then the ear canal. This is the external auditory or external acoustic meatus. Okay, then eventually we come to the eardrum, which is the tympanic membrane. Okay, so there's the tympanic membrane. And then we have the three ear bones or three ear ossicles. And they are in order, the malleus, the incus, and the stapes. Okay, the stapes connects to the oval window, which now allows the sound waves to go inside. The vibrations and all that will go inside this part. Okay, so as sound waves go in, they will eventually go into the cochlea, so this area, the snail body, if you will. So to me, this kind of looks like a snail. So here's the snail's body, which is the cochlea. Okay. Then we have the semicircular canals. Okay. We have the vestibule part, which is right here. So this is the vestibule area. So cochlea, vestibule area, and the semicircular canals. Okay, this is cranial nerve 8 coming in. Okay, so the wire would come in this way, the nerve would come in this way, and then split. So it's the vestibulocochlear nerve, or cranial nerve 8. So you have the vestibular part, so the wire comes in and splits. One of the nerves goes to the cochlea part, and then one of the nerves goes to the vestibular part. So that's why it's known as the vestibulocochlear nerve, or cranial nerve 8. Okay, we have the eustachian tube, which is here. You might also read auditory tube, but eustachian tube is its official name. Okay, we also have a bone. So here's part of the temporal bone. So all this ear stuff is recessed pretty far into the temporal bone. Okay. Just to give you a more 3D view of this. Okay, we also have from the tympanic, from right here at the tympanic membrane and lateral, all that stuff is considered the outer ear. Okay, then you have the middle ear, which is basically where the ear bones are. And then you have the inner ear, which is this snail part, the cochlea, vestibule, and the semicircular canals. Okay, the outer ear and middle ear are responsible for hearing, and the inner ear is going to be responsible for hearing and balance. The cochlear part for hearing, and the semicircular canal area for balance.